Hey guys, my name is James Spatafor.
Hi class, my name is Philippe Abgani.
Hi, I'm Jason McKay and we're Group 6. In 2017, 26-year-old diabetic Alec Rashawn Smith aged out of his mother's insurance plan. Alec and his mother looked into other plans that he could join, but decided to pay cash for insulin since the insurance was so expensive. Without insurance, his diabetes supplies cost $1,300 a month, so he decided to ration doses to make it last longer. 3 days before his next payday, he ran out of insulin and died from diabetic ketoacidosis. Should companies who develop life-saving drugs be protected? How can we help those who can't afford it? Our goal today is to discuss possible solutions to this problem, such as importing cheaper drugs from Canada.
And so as we consider importing cheaper drugs from Canada, we have to consider the ethical issues that revolve around quality, ensuring we get drugs that are effective in treatments, the regulations on drug development on how it's made and what's being put in it, and safety to ensure that all Americans and those living here in the US are protected from harm. We also have to consider ethical issues on why we want to import here in the US. When it comes to pricing, pharmaceutical companies have higher pricing for drugs here compared to the drugs that they export, which is significantly lower. Now, this may be a strategy such as dumping, where companies might export drugs to another country at a low price before they increase it after a period of time. However, we haven't found a good example of a pharmaceutical company that does this, where this would be the case. And also consider pharmaceutical companies such as the one previously ran by Martin Shkreli, here in the image, who had bought rights of a life-saving drug and increased pricing to 5,000%. Availability. Certain life-saving drugs might not be available here because the FDA does not approve of certain ingredients. Regulatory challenges such as the FDA review process can take 10 months to a couple of years to reach to phase 5. Next, a short video on what pharmaceutical companies consider in terms of ethics.
There are ethical issues every day. There are ethical issues, a lot of ethical issues around the clinical trials. And for example, if you have a drug that you're pretty sure is going to work, and we're required in a number of cases by the FDA to have a placebo group. And nobody wants to be in the placebo when we're doing a survival trial. Nobody wants to be in the placebo group, and one could question whether it's ethical to even have a placebo group, or whether you should just put everyone on the drug and compare it to historical standards, which of course is not as good an experiment, that's for sure. But these are real folks that you're treating.
Now let's look at the laws that would have an effect on imported drugs. First, the Prescription Drug Marketing Act of 1987, which establishes legal safeguards for prescription drug distribution to ensure safe and effective pharmaceuticals. This ensures that drug products purchased by consumers are safe and effective, protecting consumers from counterfeit, misbrands, and expired drugs. Next, the Medicare Prescription Drug Improvement and Modernization Act of 2003, directed at a Medicare program where the primary issue is that it prohibits the federal government from negotiating discounts with drug companies. However, this does provide subsidies and tax breaks. Now, the recently introduced Medicare Drug Negotiation Act of 2019, however, it has not yet been passed, which allows for the Centers of Medicare and Medicaid Services to negotiate with pharmaceutical companies regarding prices for drugs covered under the Medicare prescription drug benefit, as the current law prohibits the center from doing so. Also, the recently approved America First healthcare plan of 2020, which not only looks to lower prescription drug costs, but also seeks to force insurers to cover pre-existing conditions, even if the Supreme Court kills Obamacare. Now, this is not a law, but patents protected by law regarding drugs have been monopolized. Going back to an earlier example of Martin Shkreli, he had bought the patents and rights for Daraprim, where each pill was $13.50, and he had increased the price to $750 per pill the next day. As we consider patents, we also have to look into trade agreements under NAFTA. A short summary of NAFTA's Article 1709. Patents prohibits commercial exploitation in its territory of subject matter of the patents. This section includes pharmaceuticals, meaning pharma companies currently don't have strong patent protections that extend to Canada and Mexico. However, the newly proposed draft of the United States-Mexico-Canada Agreement, seen under the crsreport.congress.gov, proposes patent protections for pharma companies to extend to our neighboring countries.
All right, so next for research and findings, we have the public opinion on this matter. So as you can see from the graph, the majority of the public does favor allowing Americans to buy prescription drugs imported from Canada. According to the study, 78% of the country does favor this importation from Canada. And it's not along political lines at all, as you can see, whether it's Democrats, Independents, or Republicans. Basically, the majority of the Americans are in favor of importing prescription drugs from Canada. All right, so next we have the drug importation cost for basically how we would get prescription drugs from Canada into the United States. So Canadian drug prices are 28% of the US prices, which is obviously a huge reduction, which would put the cost down for American consumers down a great amount. So actually just last week, the America First Health Plan was approved on September 25th. It poses no additional risk to the public's health and safety and will result in significant reduction in the cost of covered products to the American consumer. This new plan that has been approved will allow Canadian drugs to come into the United States in a safe way. There is no exact cost savings yet because they do not know which drugs specifically will be imported. That will be decided at a later date. But it could be hundreds of millions to billions of dollars that the cost could be reduced in the United States if we're able to import drugs from Canada. Now, the main negative cost is the safety, and that is what leads into our next topic. Okay, so next we have the liability and security of other countries when it comes to drug importation. As I previously said, this is the main concern for drug importation. No Health and Human Services Secretary has certified importation until this past week when Alex Azar did to get this new plan into works. And this is big news because since 2003, they've actually had the opportunity to do this, but no one has ever gone through with it. 4 former FDA commissioners have voiced concern over this, and it's mostly because at this point, the importation would open a closed loophole that would increase the likelihood of counterfeit drugs in the United States. This actually piggybacks a little bit off of the last group's presentation, where we saw how rampant the counterfeit drug market is, and if they were allowed to come in from other countries, it would only increase that market. This would obviously incur additional costs for ensuring safety, but really this is the main concern with drug importation is the liability and security of other countries' drugs coming in.
Now let's look at the costs of research and development. According to the Innovation, Science and Economic Development from the Government of Canada, generic drug development costs $3 to $10 million. Non-generic drugs cost up to $1.4 billion. Here in the US, according to an article through the US National Library of Medicine, National Institute of Health, between 2009 and 2018, the median cost of research and development required to bring a new drug to the market was estimated to be $985 million, and the mean was estimated to be $1.3 billion. Now begs the question, why do we still charge higher prices? And if the estimates within the past couple of years are a few $100 million more for drug development in the US, why is the gap between our prices and Canada still a huge difference, as you can see here in this table taken from CanadaPharmacy.com? Well, let's take a look at the process of drug development of the US and Canada and see if we can find something. First, let's take a second to look at the drug development process in Canada. The main things we want to focus on is a process, as you can see up top, with drug discovery and the time frame of how long the entire process takes. What about the US? Is there any difference? We have the same discovery, same preclinical and clinical trials, and same review and marketing processes afterwards with the same timelines. As you can see in the process and timeframes for drug approval, they're basically the same. This makes it easier for us to import pharmaceutical drugs from Canada, especially since the prices are less. Perhaps we have to consider that some of the increased costs associated with pricing here in the States might be related to middlemen increasing prices after buying patents post-development. Having monopolized drugs without regulatory pushback also grants pharma companies to charge what they want in order to make a profit, as that would be the primary goal, and that will also determine what drugs they make. they can't make a profit on that drug because there isn't a sizable market for it, then why develop it at all?
Okay, so next we'll take you through the case questions that were presented in the case and give you guys our answers to them. So first of all, should the United States legalize the importation of lower cost pharmaceuticals? If so, should this apply to individual consumers, pharmacies, or other entities? To quickly answer the question, yes, we do think they should legalize the importation of lower cost pharmaceuticals. The American people deserve to be able to get lower costs for their drugs, especially when other countries are getting such lower prices, and the U.S. is really price gauging us. But it's first up to the government to allow it, which, as we previously said, is in the works right now. And the lower cost would apply to consumers, first and foremost. Like I said, you need to lower the cost so everyone can have access to these drugs easier that they need.
If the United States were to permit importation of lower cost pharmaceuticals from Canada, what safeguards should be enacted to help assure the safety and efficacy of the imports? Well, we do have laws that currently protect us, such as the Prescription Drug Marketing Act of 1987, which should be extended to pharmaceutical imports. And we should consider officializing a standard for determining pharma drug approval development and approval processes with companies that we trade with. If the United States were to permit importation of lower-cost pharmaceuticals from abroad, should this importation apply to all foreign countries or a limited number? If a limited number, what should they be and why? Well, it should be a limited number with countries whose pharma drug development and approval processes are similar to us and Canada, and should they want to export to us, we would have to consider that they follow an approved standardized process which we can determine the overall safety and use of the drug.
The next question is, should regulations be put into effect that guarantee savings are passed on to consumers? For many people, purchasing these drugs is a necessity, and suppliers know their customers have no other options. Because of this, there should be regulations in place to protect the consumer. An example of such a regulation can be found in the Executive Order on Lowering Drug Prices, found at whitehouse.gov. It limits drug prices for the Medicare program to the most favored nation price. Basically, this means that the drugs are to be sold in the U.S. at prices that are similar to the prices they are sold at in other countries, after being adjusted for national gross domestic product, among other things. It works under the assumption that if a company can make a profit selling the drug at a given price in another country, they should be able to make a profit selling at a relatively similar price in the United States. However, keep in mind, part of the reason we are in this situation is because of the law that prohibits negotiating drug prices. We need to make sure we don't swing the pendulum too far in the other direction to the point of damaging the supplier. The last question is, why are consumers requesting a reduction of import restriction for pharmaceuticals and not for other products? Historically, during times of natural disaster, some people will take advantage of those in need and dramatically increase the price of essential goods like water. This is known as price gouging, and it is against the law in about 2/3 of the United States. Doing the same thing for life-saving medicine is viewed by most as unethical and malicious. The drug prices are higher than many can afford, so they look for cheaper options. Importing drugs would reduce consumers' costs and create competition for U.S. suppliers, hopefully causing drugs to become more affordable. To summarize, we propose a set of short, mid, and long-term solutions to solve the problem of high drug prices. First, we need to legalize importation of drugs from Canada. This can be done relatively quickly due to Canada's advanced medical industry and will help but not solve our current problem. Second, we need to create a program that will develop reliable and safe sources of drugs that we can import from other countries. But ultimately, to solve this issue, we need to repeal the law that prohibits drug price negotiation. This solution will likely take the longest, but it's an important step to removing the overprotection of the American drug supply industry. What surprised me the most about Alec Rashawn Smith's story is that after insulin was developed in 1923, its patent was sold to the University of Toronto for $1. Currently in the US, the list price for a 10-day supply of insulin can be as high as $300. A similar amount of insulin in Canada costs around $30. Drug companies have been overprotected to the point of harming the American consumer.
All right, so lastly, we have the questions for the class to prompt the discussion. First of all, are you in favor of allowing the importation of drugs, and why or why not? What are the upsides and downsides of our recommendations, and would you change anything about them? And lastly, are the expenditures on drug research and development in the United States worth the investment?